Hi folks, welcome back. If you're preparing for your forthcoming medical school or dental school interviews, you'll know that ethics will form a massive part in your thinking. Today, I want to tackle a very important topic. It's a core pillar of medical practice. I like to call it one of my big C's, and this is confidentiality. It's not just a nice idea. It's a legal and ethical requirement for you to think about because it will underpin that relationship you have with your patients. It will underpin that crucial aspect of interaction you have with your patients. It will shape how you perform in your interviews and also how you perform as a future medic and a future dentist. Simply put, confidentiality means keeping a patient's information private and secure. Just think about it. Bear with me. As a doctor, you can only provide the best care if you have a complete picture of what your patient's thinking and what they're going through. If patients fear, the deepest, the most personal secrets, like mental health struggles, sensitive sexual history, if they think it will be shared by you, by the profession, will they be honest with us? The answer is no. So the primary purpose of confidentiality is to foster trust. Trust ensures patients feel safe enough. Trust ensures that they disclose everything that's necessary for their diagnosis and treatment. Without trust, medicine grinds to a halt. So what's your legal and ethical duty here? Well, as an aspiring medic and dentist, you need to know that confidentiality is governed by two main factors. These two main factors in the UK are, first of all, ethical guidelines as laid out by the GMC. The GMC and the GDC, for that matter, they set out professional standards. Their guidance is clear. Information entrusted on us by patients should not be disclosed without their express consent, unless of course there's exceptional justified reasons, i.e. their safety and others' safety, that you need to think about. The bedrock of our profession is how we behave, how we respect these boundaries. The second, of course, is the legal framework, i.e. data protection. On the legal side, we have data protection laws, like the UK GDPR. These laws mandate you and me on how to manage patient information, from paper to digital files. How are they to be collected? How can it be stored? How can it be shared securely? And violating these rules can lead to serious legal consequences, and not just professional sanctions. So you'll have picked up on what I said earlier, i.e. sometimes the exceptions. So when can we break confidentiality? Right, so this is where it can get a bit complex, and you need to understand this and be able to articulate it in the interviews. It is often the focus of medical school and dental school interviews. When they ask you these questions, they'll need you to articulate this well. Confidentiality is not absolute. There are very specific circumstances where you might need to break it. Okay, so what are they? Well, I would broadly put it into two main areas. One is mandatory disclosure, i.e. when there is a clear legal requirement, okay? And examples would be when you're compelled by the court of law, i.e. you have to provide evidence for a case and the judge is asking you to do that. Medical tribunals, legal cases, things like that you might have to give evidence for. And also notifying diseases to public health, i.e. suspected measles, COVID-19 behind us, these type of things you have to notify legally. Then of course you have the justified disclosure procedure, i.e. where you may have to break confidentiality. And this can be an ethical tightrope to walk, i.e. breaking of confidentiality when you believe that disclosure is in the public interest. You want to prevent serious harm. to the patient or to the public or to other colleagues or you even. A scenario I might paint for you is, let's say patients, right, they confess to you that they plan to seriously harm a specific person, or they might have a serious medical condition like epilepsy, for example, and that makes it dangerous for them to drive at the moment. So you can imagine if they're driving, they could be a harm to themselves as well as to others, the public. And if they are refusing to obey the law, i.e. not drive, if they are refusing to, let's say, be civil, i.e. they might harm somebody, then the safety of the community or the other person outweighs the confidentiality of your patient. And at that point, you might have a duty to break confidentiality. The key concept here is proportionate disclosure, i.e. you break confidentiality, but you only share the minimum amount of information necessary in that particular circumstance, and you break confidentiality to only the appropriate people, i.e. the person who wants to harm a specific person, you might want to talk to the police. The person who is driving and shouldn't be driving, you might need to speak to the DVLA. So yeah, proportionate disclosure. Now, it is advisable to inform the patient in advance that you intend to do that. But of course, sometimes it can be potentially dangerous or risky for you to do that. i.e. if the patient is threatening to harm someone else, could they be a threat to you? If you tell them, look, I'm going to tell the police about you. You know what I mean? So yeah, you got to weigh that up. In interview situation, also have consideration for under 16s, i.e. Gillick competence. Can that young patient's information be kept secret from the parents? The answer to that, of course, is yes, if the doctor feels it is appropriate. And also if that young person is Gillick competent, meaning they've got maturity and understanding of the decisions they're making and the treatment process involved. Also think about team care. Patient information is shared with the healthcare team, like doctors, nurses, therapists, only on a need-to-know basis, i.e. to coordinate care. This we see as a phrase implied consent, i.e. sharing with the team. So remember, this is for you in moving forward. Confidentiality is the mechanism that maintains trust. Maintaining trust in our profession, in the quality of care we provide, and it's a balance between protecting the individual and protecting you and me, the public. I hope we found this helpful. Have a look at our website for other hot topics, blogs, and advice that you might benefit from for the interviews.